Good afternoon. Welcome to the Professional Development PD session for trauma nurses managing stress and their overall well being. Let's begin. So, we'll start off with this session, will aim to provide trauma nurses with essential tools and strategies to effectively be able to manage stress, enhance overall well being, and achieve a balanced life, both professionally and mentally. Next, we'll talk about understanding the stress levels with the lows, the medium, and the highs. Basically, we'll begin with the lows. The lows occurs when tasks or challenges are manageable and can provide motivation and energy. Next, I'm going to provide an example for you. Preparing patient equipment or attending a routine training session, the impact of this can be a low stress, enhanced performance, boosting focus and efficiency. Next, I'll address medium stress. This is where it gets a little tricky. Medium stress occurs when demands increase but remain manageable. Like, for example, managing a moderate influx of trauma patients or responding to an emergency situation during a shift. The impact can extend. Medium stress can lead to burnout, anxiety, and drop in overall well being. Next, you have the extended medium stress. This can lead to burnout, anxiety, and drop in overall well-being as well, like I just said. Next, the high stress. We know high stress take us to a different level. Sorry. High stress is overwhelming and it can cause both emotional and physical exhaustion to one. It often arises when nurses face multiple high pressure situations simultaneously, leading to cognitive overload. Which, for example, managing multiple critically injured patients during a mass casualty incident, we know can leave a very big impact on one's mental process or ability to function daily. Next, if it's prolonged, high stress can pretty much hinder the decision making, lead to burnout, and negatively affect satisfaction and patient care. And we don't want that to happen. The intrusive benefit in distress management is what we're going to move on to. Which this definition, intrusive, is positive, motivating stress that enhances performance. It also, these are some of the benefits of it as well. It increases focus and mentally clarity. It boosts problem solving abilities and performance under pressure as well. It improves job satisfaction when managed effectively as well. Next, distress management strategies. These are some things I want guys to think about when you think about like a breathing exercise, which this is a technique such as you can use as like deep breathing, something like that can help lower heart rate and reduce the anxiety level. Also, cognitive behavioral therapy, sitting down talking to someone, that can help as well. And it also help nurses address negative thought patterns and manage their anxiety or what they're feeling. Then you have mindfulness practice. Regular mindfulness exercises like meditation, mindful breathing can reduce distress and enhance emotional reliance. Next, we'll talk about the impact of well-being and professional and personal on your personal life as well. First, nurses who manage stress and prioritize their well-being tend to exhibit higher job satisfactions. They also have a well-balanced approach to health, improves teamwork, communication, and reduces the likelihood of the workplace. So next we'll talk about the personal life aspect. Stress from work can negatively impact relationships, your sleep, and your overall happiness as well. It also can be the well-being can contribute to emotional balance, physical health, and stronger social connections, which enhances long-term professionalism and satisfaction in a job. Next, we'll talk about managing stress through a healthy, balanced lifestyle, which we know in the physical aspect, you have to exercise daily, or not maybe daily, but long as you're exercising, but it has to be regularly. Making sure you're eating a well-balanced meal and cut out the fatty foods, the acidy foods, and things like that. Mentally, from the perspective, mindfulness, meditation, which is my favorite. Then we have sleeping hygiene. You have to make sure you get enough rest at night. And nurses you have to aim for at least 7 to 9 hours of sleep each night to optimize cognitive function and emotional well-being as well. Next, we have managing stress through a healthy, balanced lifestyle. Basically, you can look at it as spiritually. You have to reflect, or you can have spiritual practices. Then, rationally, look at the social support, healthy communication. Professionally, you got to have time management, just like we use in school. Then, you have professional development. You have to professionally be developed and know how, which engaging in ongoing education and career advancement opportunities fosters competence and confidence in helping reduce work-related stress as well. Next, we've come to the end. Basically, this handout offers practical tips for managing stress and maintaining overall well-being in a balanced way. By focusing on physical, mental, emotional, spiritual, rational, and professional health, trauma nurses can achieve a well-rounded lifestyle that supports both career success and their happiness. These are some things that I've put in the handout just to give you like stress levels and basically the low stress levels, the medium stress levels, high stress levels, some things that you can take home and look over and read. Also, I left some benefits and resources for physical well-being, mental well-being, emotional well-being, spiritually well-being, and rational well-being as well to take with you. Now, this concludes some of it. We're going to take a 15 and we'll be back. This is the end of this presentation. Hope you enjoyed it and hope you take away with some interesting information from this message today. Have a good one.